Hello, this is Dr. Brenda John with another informative. Today I'm going to talk about a very informative topic, neurodevelopmental disorders. Neurodevelopmental disorders are a group of conditions that affect the development of the brain and nervous system, resulting in difficulties with communications, social interactions, and behaviors. These disorders typically begin in childhood and can have lifelong effect on an individual's functioning and daily life. Neurodevelopmental disorders can have a significant impact on a person's daily life, including their academic and social functionings. Treatment may involve a combination of therapies such as behavior therapy, speech therapy, and medication, so depending on the specific disorders and individual's need. So early identification and interventions are important for improving outcomes and quality of life for individuals with neurodevelopmental disorders. So parents, I want to make sure that you understand anyone whose child are struggling or suffering through any type of symptoms. So please take them serious before it gets too late. So now I'm going to talk about the symptoms of neurodevelopmental disorders. These symptoms of neurodevelopmental disorders can vary widely depending on the specific disorders. So in general, some common symptoms of neurodevelopmental disorders include delayed or abnormal developmental speech or motor skills, difficulty with social interactions and communication, repetitive or unusual behaviors, hyperactivity, impulsivity, and inattention. So difficulty with learning or academic skills, problems with executive function such as planning and organization, sensory processing issues such as oversensitivity or undersensitivity. So both can be are the symptoms of neurodevelopmental disorders to stimuli. Intellectual disability or developmental delay, sleep problem, anxiety, depression, or other emotional behavior problems of neurodevelopmental disorders. It is important to note that not all individuals with neurodevelopmental disorders have all of these symptoms, and the severity of symptoms can vary widely. So some symptoms may change over time, and some individuals may develop coping mechanism or skills to manage their symptoms. So it is really important that a diagnosis of neurodevelopmental disorders should be made by a qualified and professional healthcare, like a psychologist, a psychotherapist, so based on a comprehensive evaluations of symptoms and medical history. So what age group or gender are more effects of neurodevelopmental disorders? So these disorders can affect individuals of any age, gender, or cultural backgrounds. Typically begin in childhood and may be more commonly diagnosed in males and females. Here I want to raise a point that I have seen in many Asian countries, parents do not really pay attention on any of the symptoms if their child have in their early childhood. So it is really important parents to educate themselves to watch out for their kids' symptoms if anyone is struggling through it, to get all right. So diagnosed in male and females. So for example, ASD, autism spectrum disorder, is typically diagnosed in early childhood with symptoms usually appearing before the age of 2 or 3. So it can affect males more frequently. According to the research, it can affect males frequently than females, and suggesting a male to female ratio of approximately 4.1. So ADHD, attention deficit hyperactivity disorder, is more commonly diagnosed in males than females, with estimates suggesting a male to female ratio of approximately 3.1. So some researchers have suggested that ADHD may be undiagnosed in females, as girls may present with different symptoms than boys. Other neurodevelopmental disorders such as specific learning disorders and intellectual disabilities can affect individuals or any gender and may be diagnosed at any point during development. So it is important to note that while some developmental disorders may be more common in certain genders or age groups, they can affect anyone. And early identification and interventions are a key to improving outcomes and quality of life for individuals with these disorders. So, it is important to understand that mental health issues can worsen over time if left untreated. So, mental health issues can often worsen, making them more difficult to manage if not treated timely and professional. It is important to understand and realize that seeking timely treatment can help address issues before they become worse. Thank you so much for watching my video. See you next time.